As a healthcare provider, you work hard to make sure your residents are part of a comfortable and healthy environment. To prevent the spread of infection, practicing good hand hygiene may very well be the single most important thing you can do. Yet in healthcare settings everywhere, hand hygiene compliance is a major concern. The Centers for Disease Control and Prevention guideline for hand hygiene in healthcare settings cites several studies that show healthcare-associated infections decrease when healthcare workers adhere to recommended hand hygiene measures. The CDC guideline clearly defines when and how healthcare workers and staff should practice hand hygiene and provides strategies to promote compliance. The guideline recommends hand washing with soap and water when hands are visibly dirty or soiled. If hands are not visibly soiled, an alcohol-based hand sanitizer is recommended in all other clinical situations. It also recommends using hand lotions or creams to minimize skin irritation and dermatitis associated with frequent hand hygiene. Compliance with the CDC hand hygiene guideline is required for facilities accepting Medicare and/or Medicaid residents. The Association for Professionals in Infection Control and Epidemiology and the Society for Healthcare Epidemiology of America has estimated that each year as many as 3.8 million infections occur in long-term care facilities in the United States. Preventing the spread of infection in long-term care is especially challenging due to its unique care environment and the status of immune-compromised elderly residents. Long-term care facilities are home to these residents. Guests and family visit often, which increases the risk for exposure to infections. Transfers between hospitals and the long-term care facility create another infection control challenge. According to a report in Infection Control Hospital Epidemiology, infections are a leading reason for hospital transfer to long-term care facilities for residents, with the resulting hospital costs ranging from $673 million to $2 billion each year. Adding to the problem is the belief held by many long-term care staff that disease-causing bacteria can only be found in body fluids, such as blood, urine, feces, or in open wounds. But in fact, microorganisms such as bacteria and fungi can live in places all over the body, including hands and wrists, in the groin area, and even under arms. Many pathogens can also survive in the environment for days or even months. Your hands may be contaminated through contact with surfaces or objects. Consider all the ways caregivers and residents come in contact with each other every day. During routine care, by assisting with mobility, during recreation, giving affection, delivering medication, and even sharing surfaces like linens, sinks, doorknobs, and wall railings. With all the exposure points, it's certainly possible for a healthcare worker to transfer germs to residents, co-workers, visitors, and even family members. Hand hygiene is most effective when everyone is included. As the healthcare provider, your behaviors, such as using proper hand hygiene practices, helps residents and visitors model good behaviors as well. When you take responsibility for demonstrating and promoting good hand hygiene practices with your residents, you protect everyone from harmful infections. The Centers for Disease Control and Prevention recommends washing your hands with soap for at least 15 seconds and thoroughly rinsing with water, but not hot water, in order to reduce the risk of dermatitis. When washing your hands, first, wet hands under warm running water and then add soap. Rub hands together to make a lather and scrub all surfaces. Rub soapy bubbles all around for at least 15 seconds on hands, wrists, between fingers, and under fingernails. Rinse under warm running water. Dry well using a paper towel. Use a new paper towel to turn off the faucet. In addition to the CDC hand hygiene guideline, the World Health Organization promotes 5 specific moments when hand hygiene should take place. First, before resident contact. Second, before any aseptic task. Third, following body fluid exposure. Fourth, after resident contact. And finally, after contact with resident surroundings. Following these guidelines protects you, your patients, and your environment from harmful germs. Selecting good hand hygiene solutions involves an understanding that not all products are the same. Look for products such as Pravon hand washes that are formulated to provide gentle and effective cleansing. Pravon products help keep frequently washed skin healthy and helps reduce the spread of germs. To minimize the occurrence of dermatitis associated with frequent hand washing, use a hand cleanser with added moisturizer or a hand lotion or cream such as Pravon hand and body lotion. When hands are not visibly soiled, the CDC strongly recommends using alcohol-based hand sanitizers. Apply the product to the palm of one hand and rub hands together, covering all surfaces of hands and fingers, including nails. Do this until hands are dry. This takes at least 15 seconds. Alcohol-based hand sanitizers are quick, easy, and effective. And according to the CDC, alcohol-based hand sanitizers are more effective for routine hand hygiene than plain soap or antimicrobial soap. They're proven to be more gentle on the skin, causing less skin irritation than frequent hand washing. Formulated for highly effective broad-spectrum antimicrobial activity in high-use environments, Purell kills 99.99% of most common germs that may cause disease while being gentle on the skin.